Thank you. My name is Gloria Kahamba. I work with D3 in Tanzania. And D3 is an INGO or international organization. We are a digital health organization, and we are focused on improving access to essential healthcare services, focused on sub-Saharan Africa. And our motto is better decisions save lives, which means we believe if people are supported to make better decisions in their lives at any point, especially as they seek healthcare, they are able to improve their healthcare and hence their lives as well.
Well, and it's one of the original organizations that has been so foundational for the Global Digital Health Forum journey, and you're also the group that provides the Mark Mitchell Scholarship Award every year. We just heard from one of the grantees who has an amazing operation in India. He was so grateful to be here. So we also thank you and your organization for that contribution to the community. So I've been asking people on camera to share a little bit about the work that they do, but contextualized around some of the challenges that are coming up again and again as we turn the corner into a new year. I don't know if in your role at D3 there are anything you might want to share with the folks who are watching, just so that we have some common threads for what are people up against in this era. I know there's funding constraints. I know there are a number of challenges in trying to adapt AI into programming. What's top of mind for you all at D3?
Yes. Thanks. Yeah. For us, I think also reflecting on where we are coming from as D3, and right now actually have a new strategy whereby we are focusing on people-centered healthcare.
Okay.
One of the things that we're seeing, or one of the challenges, is that, and we talk about it a lot when we're in these conferences, is the presence of many digital systems, many apps, pilotitis. We hear that coming up so many times.
Yeah.
And even today I heard in one of the sessions somebody talking about pilotitis for AI, where we are right now. So we are in a stage right now, especially with limited resources, whereby we need to think about how we are going to be able to integrate systems, but not just integrating systems, but also integrating care, integrating healthcare services, and providing coordinating care. Because if we think about it, we are serving this community, we are serving an individual, right? This individual seeks care, they go through a healthcare journey, but what are they facing through this healthcare journey? So for D3, we work in communities, but we also work with healthcare facilities, and we are really interested in looking at the overall journey as the client has different touch points, right? They may be seeing a community health worker, but they may also be going to a dispensary, for example, which is a primary healthcare facility. So what kind of care are they seeking? What kind of care, what quality should they be getting really from the community level to the health facility level? And how do you support that referral system, right? And also the feedback loop to ensure the healthcare facility has the information they need to provide care, but also the community health worker has the information they need to be able to provide care. So right now, with limited resources and we need to work strategically, but also leverage these resources so that we are working efficiently. So for us at D3, we really value working together with the government. So right now we're actually working with existing government systems, and we are working to improve and strengthen those systems and ensure that they are comprehensive to be able to support care at the community level, but also at the health facility, and also continuity from the community to the health facility.
I mean, it sounds amazing, and probably very hard to get all those pieces right, to get that kind of buy-in from the government, to be able to provide that continuity of care for that individual that's seeking it, and to make the data work at every step of the way.
Yes.
I think a lot about D3 in this new era. You all were doing decision tree support stuff way back when, 2010, 2015, well before AI, trying to think about empowering that community health worker, that frontline health worker, with a slew of information at their fingertips on a phone. How has that evolved now in the AI era? You probably had to rethink some of the models and or maybe not. Maybe it's just sort of you built the model and this new technology gets layered into it.
Yes, so I think there are things working in parallel as well. Yes, AI is coming up, and for us, it's something that we are looking at. And actually, in some of our programs in Zanzibar, there are some pilots testing some AI models. But we also look at what the context is and the digital health maturity as well. So if you look at right now, there is a lot that is needed to strengthen existing systems, and even make them work, connect them, but also the quality of data is important.
Yeah.
Even when you're talking about AI, where, in all these sessions, they're saying, quality of data is important and all of that, but we have a lot of data, I would say, but like quality is still, I would say, a challenge.
And then,
so I would say
sure.
for us, at least in D3 Tanzania, like our key focus is really what is already existing, and let's strengthen those. And the innovations can also come as part of, so it's not like separate, but it should be able to support the national priorities and
Sure.
the government priorities, but not just something separate.
Well, it's amazing work you're doing. With the few minutes or the minute we have left, is there anything you're really excited about that you want people who are watching at home to know about D3 or about you? Anything that you're really fired up about as we turn the corner into next year?
Thanks. I'm really excited about our new strategy, and I've seen that there's sessions here, and we have had so many discussions with different people.
Good.
And it's interesting to see that there is similar thinking in terms of integrating systems, focusing on quality healthcare services and quality data, and looking at innovations that work, innovations that are actually, communities need. They are going to help their communities, not just innovations for the sake of innovations. Personally, I usually say, I don't look at shiny things. I want to look at things that we actually need and that are actually going to help in the delivery of healthcare services at the primary healthcare level. So I'm really excited to see discussions. I've gone to discussions around how to support community health workers, deliver digitally enabled care, strengthening primary healthcare systems, and also there is discussions today, especially around non-communicable diseases and integrating that within existing systems, which is something we are doing. So that's what I'm excited about.
All right.
Yes.
Well, listen, we thank you so much for being here in the pop-up studio, for the work that you're doing with D3. It's truly incredible, and it's great to see this continuity year over year from your organization. And we wish you a wonderful rest of your conference as you meet and continue to engage with the sessions here.
Yeah, thank you so
All
much.
right,
Thank you
so
for the
much.
time.